We have Dr. Rangnath Sangale and he's practicing in Maharashtra.
I'm Dr. Deepak Jain.
And we also have Dr. Deepak Jain and he is practicing in Ghaziabad. Well, today we're going to be talking about kidney stone management, and it's always amazing, always good to have a word with the doctors, and I, on behalf of you all, asking the questions from the doctors. We're going to be starting with Dr. Rangnath Sangale. Why do you think the number of cases of kidney stones are on a higher rise these days?
Kidney stone incidence is now increasing because of the internal factor as well as external factors. Internal factors, they are the metabolic causes where the calcium in the blood is increasing. The other excretory products, they are more in the urine. The amount of urine formation is less, so it becomes a concentrated urine. That's why the stone formation is much more. Whereas external factors are the diet, which is nowadays more or less not what you call as a healthy diet. That food contains lot of chemical ingredients and this thing. That's why the formation of stone is much more.
Anything would you like to add?
I think diet is the main factor with high protein and high salt diet.
Okay. So, well, I would like to ask you, what has been the most challenging case of kidney stone you have ever dealt with, and how did you remove the patient's stone?
I had a patient of 42 years old with a big stone.
Okay.
Almost 32 millimeter stone is there. There were multiple stones in each calycis of the kidney. In the kidney, there are compartments, various compartments, and almost every compartment was having a stones. So that was a challenging case. The other kidney was also having some small stones. So there was always a risk when the stones are on both the sides. I removed all these stones in a one sitting. 100% clearance I gave. And that's one of the complicated case I dealt with.
So, how is he doing now? Good?
Patient is absolutely fine. Almost 14 years he is there for follow-up, coming almost every yearly, getting ultrasound done.
Well, when we are talking about this, we have the patients who come with recurrent stones, because the chances of recurrent stones are higher when he already had one. I think it's 50%.
50%.
So how we can tackle the recurrent stones, or how we can avoid it? I would like to know from you.
Again, I would recommend dietary modifications.
Okay.
That is high water intake and low salt, low protein diet. This is the main advice.
And a regular follow-up maybe.
Yeah, definitely.
With the doctor. And in your experience, what precaution one can take effectively in order to avoid having kidney stones? For example, there are a lot of misconceptions or the myths. So I would request you to break those myths in order to give the patients a better idea that this is not how it works. So you could tell.
I always advise patients to have plenty of fruits.
Yeah.
And that should be round the clock. Most of the patients, what they do, they drink lot of water in the morning and whole day they are dehydrated.
Yeah.
So first thing, it should be round the clock hydration. Second, again, salt intake and protein intake. That should be in moderation, never in high.
All right.
And to avoid the recurrence, I learned commonly what happens during the surgery, you just remove the stone. Patient also feels that he is relieved of the problem. But at the same time, before surgery, before the treatment, we should come to a conclusion why the stone is forming. There are intrinsic factor, extrinsic factor, as well as there are some anatomical defects, where some obstruction is there for the flow of the urine. That is one of the important cause. And you have to correct that obstruction, that cause for stone formation, so that recurrence will not be there. Second is the dietary things. You have to explain them what things he should eat more, what things should he avoid, like that. That is also one of the...
Well, what do you think, what is going to be the next big breakthrough when it comes to kidney stone domain? What could be the next breakthrough?
You mean the treatment part?
Yeah, of course.
Yeah, now there are so many modalities are coming up.
Yeah.
The ultra-PCNL, lasers, they have changed the scenario of the renal stone. Now almost for 15 years we are doing not doing any open surgery. Almost last 15 years we have not operated done a open surgery, which previously was the mainstay. Now with the advancement of the all techniques, lasers and robotics, you are going for a smaller and smaller trauma to the patient, trauma to the kidney, and clearance rate, the cure rate, it is very good with new modalities.
Well, from Dr. Deepak, I would like to know, for the very first thing, when the patient comes, he always look for the indicative measures. So how he will get to know that I might be having a stone? What are the first symptoms we can call? Could be the indicative symptom. What could be that?
Most of the patients come with pain.
Pain. But then there are stones which are asymptomatic.
Then,
So then how it
most
goes?
of the two common presentations are pain
Yeah.
or ultrasound done for some other reason.
And then they get to know that they have this stone.
Then-
So as soon as they know that they have this stone, they have to rush to the urologist nearest.
Yeah,
Okay?
yeah, neurosurgeon.
Wonderful. Thank you so much for being here. It was very nice talking to both of you
Thank you.
gentlemen.
Thank you.
Yes.